touch the front of the mask. If you do, remember to wash your hands or use hand sanitizer. Please throw away the mask appropriately. Remember, partial protection is better than no protection.
Jamaica Eye is part of an island-wide network of camera surveillance systems designed to increase the safety of you, our citizens. If you have a camera system outside your home or office facing a public space, join us in helping to make Jamaica a safer place for all. Log on to jamaicaeye.gov.jm today. Jamaica Eye, we're all connected. The Ministry of National Security, creating a safer and prosperous Jamaica.
Sticks and stones may break my bones, but words will never hurt us. Sad to say, more than 80% of our nation's people are affected by words. Think before you speak. Educate yourself.
The good news is you can protect yourself and your family against the coronavirus called COVID-19. If someone in your home has COVID-19, no need to worry. You can help take care of them and protect yourself at the same time. Every day, clean all surfaces that are touched often, like counters, tabletops, doorknobs, and bathroom counters with disinfectant. Use household cleaning sprays or wipes according to the label instructions. Protect yourself and your parents from the coronavirus or COVID-19.
Hello, Jamaica. My name is Patsy Edwards Henry, President of the Nurses Association of Jamaica.
I am Dr. Mindy Fitzenley, President of the Jamaica Medical Doctors Association.
And I am Dr. Andrew Manning, President of the Medical Association of Jamaica.
COVID-19 has wreaked havoc on our families, our communities, our livelihoods, and our general way of life.
Globally, over 100 million persons have been infected and more than 2 million have died.
Here in Jamaica, over 21,000 persons have been infected and close to 400 have died.
Thankfully, through proactive action, we now have access to a safe COVID-19 vaccine.
I will take the vaccine.
I will take the vaccine.
I intend to take the vaccine.
And I encourage all of our frontline workers, and in particular our doctors,
our Medical Association of Jamaica members,
and in particular our nurses, to support me in championing this cause.
Let us protect ourselves and the people of Jamaica.
Vaccinate to stay safe.
This is an important message from the Ministry of Health and Wellness.
Watch the 2020.
With the Prime Minister this afternoon, we have the Minister of Health and Wellness, the Honourable Christopher Tufton. We have also the Minister of Education, Youth and Information, the Honourable Favour Williams, as well as Minister of Local Government, the Honourable Desmond McKenzie. Our Deputy Prime Minister is in our midst, the Minister of National Security, the Honourable Dr. Horace Chang. With Dr. Chang as well is the Acting Police Commissioner, Mr. Clifford Blake, and as well as here with us, the country's Chief Medical Officer, Dr. Jacqueline Bessaser McKenzie. I also, my apologies in the order of precedence, the Minister of State in the Ministry of Education, Youth and Information, the Honourable Robert Morgan, is here with us as well. May I then hand over to Prime Minister. Prime Minister, the Most Honorable Andrew Holness.
Everyone, you'll note that I have started with the mask on. Just for ease of communication, I'm going to take my mask off, but always reminding everyone that it is still required under the Disaster Risk Management Act that we wear a mask in public places. Let me acknowledge those who may be joining us online, on radio, on television, and indeed our friends in the diaspora who have joined us. Based on the latest report this morning, Jamaica recorded 673 new cases of COVID-19 yesterday. Our cumulative cases of COVID-19 are now 35,338, with 16,130 of that number recovered. So our recovery rate is now 45.6%. The number of active cases, that is the number of persons who still have the virus, is 18,426. I want to display for you a case fatality chart, which should be on your screen shortly. Yesterday, we had 673 positive cases out of 3,027 samples tested, which is a test positivity rate of 22.2%. The public sector test positivity rate, which is based on the more reliable PCR test, was, however, 36.7%. Unfortunately, 533 persons have died due to the pandemic. The case fatality rate is 1.5%. There have been deaths in every age group. However, 3.7% of those who contracted the disease in the age group 60 to 69 have died, and they account for 21.2% of all deaths. 7.1% of persons who contract the disease in the age group 70 to 79, they have died, and they account for 24.6% of all deaths. 11.6% of those who contract the disease in the age group 80 to 89 have died, and they account for 19.5% of all deaths. I offer my sincere condolences to the family of all those who have lost loved ones. And I start with this because it is important to set the context within which we are pursuing new measures. While our case fatality rate remains below the global average, the number of deaths is rising. The trauma of losing loved ones is beginning to have a visible psychological and emotional impact on the society. I'm certain that many of you listening would know someone who was either had the disease, that is, they were infected by the coronavirus, developed the COVID-19 disease, had serious complications from the disease, had to be hospitalized. And some of you may have had firsthand experience of losing someone to COVID-19, or you would have known someone who would have lost a loved one. For persons who are grieving presently and unable to cope with the pain of losing a loved one, we urge you to seek counseling. Close friends, your church, your doctor, counseling professionals, or various counseling hotlines are available. I want to shift now to displaying for you the hospitalization charts and the number of beds that we have. you can see that since the start of the pandemic, we have doubled our capacity in terms of beds, moving from 15 or 17 beds at the start to almost 600 beds presently. You would also see that the numbers hospitalized at the beginning of the pandemic in March, in April, May, June 2020, we were well below the number of beds that we had in hospitals. So the hospital capacity was there. And even when we had the spike in September, which then led to us declaring community spread, we also at that time increased capacity, and therefore we had just a very brief period in which our capacity was challenged, but it was certainly not to this point. We instituted measures then in September, measures which we have consistently maintained, and that has kept our case fatality since October relatively stable, kept our hospitalizations relatively stable and well below the capacity of beds. The red line in the graph that you're looking at, of course, represents the number of beds. The blue area would be the hospitalization on a daily basis. You can see that the blue area now exceeds the number of beds that we have. At some points, more than 15% above what we have in terms of capacity. What this means is that the hospitals are stretched. They're doing their best to take persons in, as many as they can treat. However, we should note that we can and we are now at a breaking point. We have reached that breaking point. You are seeing the videos being circulated of patients being treated in situations which we would consider to be less than the dignity that we would expect our Jamaicans to be treated with. And that is something that hurts me deeply as Prime Minister. And we're going to do what is necessary to ensure that this situation is rectified. The situation can only be rectified if persons who are presently ill recover and are released from hospitals. And we are not taking in more persons than we are releasing. In order for us to reach to this point where we are not taking in more persons than we are releasing, we have to institute even stronger measures. It is clear that the level of compliance is not going to be achieved by virtue of moral suasion or appealing to the public. It is now clear that the public is at the point where it is no longer of concern to them. And as I was explaining to some of our ministers this morning, that the government has to act in the public's interest. But the individual interest and the sum of the individual interest should not be confused with the public's interest. Some people have interest in going to parties. In my own constituency, this morning I received the news 2 persons were shot coming from a party. We have seen the police taking action right around Jamaica of people still going to parties. It is the ultimate expression of social selfishness. So be pursuing these kinds of activities which aid in the spread. You may not end up in the hospital, but if you look at the videos being circulated, the people who are in the hospital could be your grandmother, could be your mother, and indeed, even in the age group that is common to attend parties, persons are in the hospitals ill and seeking treatment. It is not the intention of the government to want to deprive people the pursuit of their happiness. But it can't be that the entire society collapses because people pursue selfish ends. So we will have to institute new measures. I'm going to ask the Minister to come up and give further details on our health situation. Minister.
Thank you very much, Prime Minister. Good afternoon, ladies and gentlemen. So as the Prime Minister said, as of Saturday, March 20, 2021, Jamaica had a total of some 35,338 confirmed COVID-19 cases on record. This comes with the addition of some 673 new cases comprising of 383 males and 383 females and 290 males. Regrettably, there were 9 deaths reported, and these deaths were recorded or took place between March 17 and March 20. This brings the total number of deaths on record to 533, and I join with the Honourable Prime Minister and colleagues in expressing our condolences to the family members and friends of those who have passed. The additional 191 more recoveries in the last 24 hours, 191 persons have recovered, and recoveries from COVID-19, some 16,130. And I want to again commend the health team for the efforts that have gone into helping those who have had COVID and are now fully recovered to resume their normal activity, some 16,130 persons. Our current positivity rate, as said by the Prime Minister, 36.7%. That's more than 1 in 3 that are tested, while the country is currently managing some 18,426 active cases across the island. And of that number, some 391 are in hospital, with 43 moderately ill and 33 critically ill. And those last 3 numbers are the numbers to watch, the overwhelming of the public health system, the hospitals in particular. 391, 43 moderately ill, 33 critically ill. And in the moderate and then critical is where we have the greatest risk of persons dying and the system becoming overwhelmed. In terms of hospitalizations, the hospital census as of Saturday, March 20, has reported some 13 hospitals in the red alert zone. This means that these hospitals are at or over 84% of its isolation capacity. One hospital, the Mandeville Regional Hospital, is at the amber zone with some 78% of isolation capacity. Of the 13 hospitals in the red alert zone, the following hospitals: Cornwall Regional, St. Anne's Bay, Spanish Town, Anata Bay, Port Maria, Maypen, Lionel Town, Kingston Public, Princess Margaret, National Chest, the University Hospital of the West Indies, Linstead and Savannah Lamar hospitals have all exceeded 100% of their COVID-19 isolation capacity. And to exceed the capacity means that we now have to house positive patients who have to be hospitalized under less than ideal circumstances. In other words, we have to put them in makeshift sections of the hospital, which is not ideal for their care. And that is the most classic indicator of a system being overwhelmed. So very, very, very challenging. In some cases, up to 150% of capacity. Across the country, the average number of daily admissions to COVID-19 isolation wards was some 56 for the week of March 7th to 13th, and this has increased to 62 for the week of March 14th to 20th, 2021. And the increase in hospitalization, of course, means that the staff has to now deal with more persons who are ill under less than ideal circumstances. And the most vivid test of the COVID response and the capacity of the system to manage that response is the capacity of our public health system, both infrastructure and people to deal with those who come into that system. And as said by the Prime Minister, this is where the greatest challenge is. It's what we don't want, but once we get there, then it requires other types of action. And I'll close here for now.
Thank you, Minister. 2 weeks ago, I had announced some tightening of measures and indicated that if there were no significant improvements in our case numbers and hospitalizations, we would then have to tighten further. And I had also indicated this in my budget presentation on Thursday. The cabinet met yesterday, and after a long, extended meeting, 7.5 hours of non-stop deliberations. And I always emphasize this point because, I don't want the nation to feel that we don't consider all angles, all concerns, everything. And it is deliberated because, people looking on the management of the pandemic sometimes wonder, how did we get here? Or why are our numbers high? Without fully understanding all the dynamics that have to be considered in the Jamaican society. On my way here, I was listening to one commentator who lamented that there will be a cricket tour of South African cricketers coming to Jamaica. Well, coming to the Caribbean, but will not be coming to Jamaica. And of course, a comparison was drawn with Trinidad. Our friends in Trinidad, their borders remain closed, effectively closed. We have had to open our borders to keep our economy going, to keep our lifeline of tourism. We have lost 75% of our tourism revenues. Other countries have lost 100%. We have managed to put in place the resilient corridor, which has meant that we have gotten some revenues. People can go back to work. And our economy has kept afloat. Over 500,000 persons have visited Jamaica since we have reopened our borders in June. Over 500,000. So the context of Jamaica is totally different from other countries that have populations far less than ours. That the considerations that we have to put into our equation to come up with our measures may not pertain in some other societies. We have to consider that if we, for example, shift our police resources into full enforcement of measures, it's the same police that we need to manage crime and other such things that the police force would have to deal with. So the Jamaican context is very much different, and so it is for every other country. So we have to consider very carefully. And then we have to consider, of course, the potential for civil unrest and social fallout. And we have to manage and balance that very carefully because we know and we understand that people are having a very difficult time because of the economic fallout. And as I said earlier, the individual calculus of risk might not be the calculus of risk that the government has. So an individual facing loss of income, children to feed, may say, well, I am not going to restrict my ability to earn and follow all the protocols because I need to have my household taken care of. The point with that, however, is that if everyone takes action that is totally maximizing their own personal gain and benefit whilst destroying what is in the public good or in the greater good, then when you need to access those public goods, for example, healthcare, you will not have it. And you may not get COVID-19, but you are likely to need medical attention for your hypertension, for your heart condition, for your asthma, or your children may need it. And there are no special beds. That the beds and capacity that we're putting in, yes, we have put in new beds, but if more people come in for treatment, then we may have to take beds. Worse, doctors may have to shift focus. So the pursuit of your individual happiness and maximizing your income is destroying a public good that you will need and the society will need. If our hospital collapses, if all our hospitals collapse, rather, your ability to earn income will also collapse. And I think that point needs to be understood very carefully. So I know we will be hearing the complaints about the restrictions, but at this point in time, those complaints fade into insignificance. The real issue now is protecting our health service and protecting those who are now being treated in the health service so that they can get the care to recover and then to prevent new admissions into the hospital. And that means it's a simple equation of slowing and, if possible, stopping non-essential and unnecessary movement, getting people to wear their masks, to social distance, to sanitize, and if they are ill, stay at home. And more than that, and above all else, when it is your turn, take the vaccine. So, after careful consideration and the need to restrict movement even further, except for essential activities, the following changes will be effected. From Thursday, March 23 to Friday, March 26, the nightly curfew hours will remain at 8 p.m. to 5 a.m. the following morning, ending at 5 a.m. on Saturday, March 27, 2021. So on Saturday, March 27, 2021, the curfew will begin at 12 noon and continue through the rest of Saturday and the entire day on Sunday. Let me say that again, the entire day on Sunday, and end at 5 a.m. on Monday, March 29, 2021. Please note that on Friday, March 26, 2021, workplaces will be required to close at noon, except for essential services, medical establishments, supermarkets, wholesalers, pharmacies, restaurants, and other food establishments, which will remain open up to the curfew time at 8 p.m. And this is to facilitate persons to conduct their shopping to prepare for the tighter weekend curfew. So let me go back over that again. From Tuesday, March 23, to Friday, March 26, the nightly curfew hours will remain at 8 p.m. to 5 a.m. the following morning, ending on Saturday, March 27, 2021. So we're maintaining the 8 p.m. to 5 a.m. curfew day to day up to Saturday of this week coming at 5 a.m. However, on Friday, we are going to require businesses to close their operations and allow staff to get in some shopping hours. So supermarkets and restaurants and so forth. Pharmacies, of course, the essential services continue to remain open, the hospitals and so forth. But the curfew is still at 8 p.m. So we are expecting that between 12 and 8, persons who would want to stock up for the long weekend would be able to do so. Now, on Saturday, the curfew begins at noon. So you will have shopping time on Saturday from 5 a.m. to noon, or church time, or stay at home. I have discussed with the Permanent Secretary, the Minister of Health, allowing vaccinations to take place, to continue to take place, because it is essential for our recovery. So vaccination centers should be open on Saturday and on Sunday. And we will explain how we will allow persons to move during the curfew hour to get vaccinated. And that is not a difficulty, because it is by appointment and it will be up to a certain time in the day. Now, so the curfew then on the weekend coming starts at noon on Saturday. We go over into Sunday, and the curfew continues for the entire day on Sunday. There should be no movement for the entire day on Sunday, except those that are exempted and permitted. And then the curfew will end on Monday at 5 a.m. So we will have a lockdown essentially from noon on Saturday to 5 a.m. on Monday. Now, from Monday, March 29, 2021, to Wednesday, March 31st, 2021, the curfew will commence at 8 p.m. nightly to 5 a.m. the following morning, ending at 5 a.m. on Thursday, April 1. So essentially, you go back to regular curfew hours, which is from 8 p.m. starting on the day to 5 a.m. the following morning. And those are the curfew hours, no movements between those times. And that daily curfew ends at, on Thursday, 5 a.m., when we then go into a different curfew regime. So on Holy Thursday, April the 1st, 2020, and this is no joke, workplaces will be required to close at noon, except for essential services, medical establishments, supermarkets, wholesale stores, pharmacies, restaurants, and other establishments which will remain open, noting that the curfew will begin at 8 p.m. So on Holy Thursday, which is one of our largest shopping days in the country, we will have businesses close at midday, which by and large, this is usually the practice. Some businesses do close early on Holy Thursday. So we will allow persons to have the option of doing their shopping from midday to 8 p.m. On the following Saturday, Friday, you're so right. Thereafter, The curfew, which would have started at 8 p.m. on Thursday, will continue throughout the entire day on Good Friday. And it will end at 5 a.m. on Saturday, April 3, 2021. So, Holy Thursday, curfew starts at 8, but businesses would end at 12 to allow for shopping midday to 8. The curfew will extend throughout all of Good Friday and would end 5 a.m. on Saturday. On Saturday, April 3rd, the curfew will begin at noon and continue through the rest of Saturday, the entire Easter Sunday, and the entire Easter Monday, and it will end at 5 a.m. on Tuesday, April 6, 2021. The curfew will commence at 8 p.m. on the days after, ending 5 a.m. the following day. So, essentially, what we are announcing is a lockdown for the weekends, and for the Easter holiday, a full lockdown as well. We are giving shopping hours from midday on Friday to 8 p.m. on Friday, 5 a.m. on Saturday to midday on Saturday. On Saturday, April 10, 2021, the curfew will begin at noon and continue through the rest of Saturday and the entire day on Sunday, and end at 5 a.m. on Monday, April 12th, 2021. On Friday, April 9th, 2021, workplaces will be required to close at 12 noon to facilitate persons to conduct their shopping to prepare for the tighter curfew hours. So effectively, we have given 3 weekends of weekend lockdown, inclusive of the Easter holidays. Now, despite the extended curfew hours, we want the vaccination program to continue, as I said before. Certain vaccination sites will remain open during curfew hours and on movement days. Persons with appointments to receive a vaccine will be allowed to do so during curfew hours. Persons will be required to present evidence of the appointment. And how it will work is you will show the text message that you would have received or your email to the police. To be clear, on no movement days, that would be the days when the entire day is under curfew, persons will be allowed to seek urgent medical care, and those who have overseas travel plans can make their way to or from the airport. Essential services will still be operational, and in this group, I would include our fisher folk and our farmers, and for clarity, the media. But I remind those persons employed to essential services who must move on the no movement days to ensure that you have your ID to present to the police. And just to be clear as well, though you are permitted to move on the no movement days, it is movement in pursuit of your job. So it is not a wholesale movement license or exemption. You are only permitted to move in pursuit of your job. And that is a very important point. And this point has been made to the police as well, so they understand that someone who presents their ID to say that, you know, they are exempted, and you say, where are you going? Well, I'm going to look for a friend. That is a breach of the curfew. Your movement must be in pursuit of your employment. Now, the existing protocols, including the requirement for all travelers to present a negative COVID test conducted within 3 days of travel, will be extended to June 30, 2021. Let me be clear. Let me clear up a common misconception. The pre-testing requirement does not mean that travelers do not need to quarantine for 14 days after arrival. The 14 days self-quarantine period still applies, and it is extremely important that persons do so. And to add further clarity, though you may have been vaccinated overseas, when you arrive in Jamaica, the protocol still remains that you must maintain the quarantine. The existing ban on direct flights from the UK will be extended to April 13th, 2021. Travelers from the United Kingdom coming through other countries will be required to test on arrival and await the test results in state quarantine at their own cost. If the test is negative, they will be required to complete the rest of their 14 days quarantine period at home. If the test is positive, they will remain in isolation until they recover. The age limit for the stay-at-home measure remains at 60 until April 13th, 2021. I wanted to spend a little time on the age limit. Minister Tufton pointed out to me that he received several complaints from persons in that age group who felt that it was quite restrictive, especially those who have to look after their business. As I said earlier, everything that we do, it is evidence-driven. And we consider it as well to be proportional, meaning that we don't employ a measure more than what is sufficient to get the result. And when we look at the statistics, and I had read that out earlier, that the age group 60 to 69, they have a case fatality rate of 3.7%. That is twice the average case fatality rate in Jamaica. And of course, as you progress in the age groups, the case fatality rate increases. So I think that measure is justified to put in place, and it is necessary to slow admissions because the persons who would have the illness, the COVID-19, and need hospitalization, they would start, the majority would start in that age group. And therefore, I think that this measure, yes, it is restrictive, and yes, I understand the issues, but I urge all persons in the 60 and over age group, as much as possible, limit your movement. So the stay-at-home order is still in effect, and this will be until April 13th, 2021. Now, workplace clusters are increasingly becoming a matter of grave concern. The existing work from home directive in the public sector is being extended until April 13th, 2021. As a reminder, the permanent secretaries and heads of agencies are directed to ensure that only persons who work in critical service delivery and perform job functions that require them to be at the physical location should be at the office. For the private sector, employers should allow all persons who can work from home to do so. Employees may still request to work from home in circumstances where they have an underlying illness which is not under control, or where they can make no other arrangements to care for a child, elderly, or ill family member, or someone who has a disability. Employers are not required. Let me just make sure I'm having that right. Sorry. Employers may still request, as I said before, to work from home, and employers are not required. My text has it a little bit confusing there. So employers are not to require employees who have COVID-19 symptoms to report to work. And it's a very important point, because we have picked up cases where employees who are ill have, because of fear of losing employment, losing income, have decided that they are going to go to work. And them turning up at work, sometimes without knowing what their status is, they become the source of spread. So to repeat, employers are not to require employees who have COVID-19 symptoms to come to work. And of course, if you are ill with flu-like symptoms or any other of the known signs of the COVID-19 illness, you should, well, not should, you must stay at home. The gathering limit will remain at 10 persons until April 13th, 2021. Public sector entities are reminded that social events, handing overs, launches, groundbreaking ceremonies, or any other similar events are prohibited until April 13th, 2021. Markets and places for vending, including at the transportation centers, the operating hours for those will be 1 hour after the end of curfew to 1 hour before the start of curfew. Therefore, when the curfew ends at 5 a.m., markets will open at 6 a.m. When the curfew starts at 8 p.m., markets will close at 7 p.m. On Saturdays, when the curfew starts at noon, markets will close at 11 a.m. Markets will remain closed on Sundays and public holidays, including Good Friday and Easter Monday, until April 13, 2021. Public transportation. The operation of public transportation will continue, and drivers, conductors are allowed to be on the road 1 hour before and 1 hour after curfew. But be reminded that no passengers are to be in the vehicles during those periods. All persons in PPVs are reminded to wear masks at all times and sanitize before entry and as you exit the vehicles. The PPVs, which are motor cars, are to ensure that the windows remain open and the AC is off during the trip. Also, motor cars that provide public passenger transportation are to have one less passenger than is allowed by the license. Schools. There should be no face-to-face instruction in all primary and secondary schools, both public schools and independent schools until April 13th, 2021. Students are to be instructed using other modalities. And for clarity, note that this includes students who are to sit the exit examination. So effectively, all schools are closed. Funeral services. Funeral services will not be allowed during the period ending April 13th, 2021, which is the existing case now. Interment or burials. The existing restrictions on funerals and burials will continue until Tuesday, March 23rd, 2021. As of Wednesday, March 24th, 2021, until April 13th, 2021, burials will be allowed Mondays to Fridays only during the hours of 9 a.m. and 4 p.m. Only 10 mourners will be allowed, and an additional 5 persons can be present who would comprise the officiating clergy, the gravediggers, and undertakers. The time for conducting the burial is not to be longer than 30 minutes. Note that no burials will be allowed on Good Friday and Easter Sunday. So let me go back over this. And Easter Monday as well. No burial on public holiday. After very useful discussions with the, as elegantly put by the Minister of Local Government, the afterlife industry. The agreement was reached that funerals would be allowed, but only burials and interment would only be allowed on weekdays. We will not allow any burial on public holidays or on weekends. And that would be between 9 a.m. in the morning and 4 p.m. The funeral itself should be no longer than the burial itself. I keep, as we do in Jamaica, put the two things together. But the burial itself should be no more than 30 minutes. And just to repeat, we are not expecting that there will be any mass attendance. That will be a breach that will be seriously prosecuted. So only 10 mourners at the graveside, with 5 members would be officiating clergy, persons who are preparing the grave, and the undertaker. That would be all, 15 persons in total per burial for 30 minutes. This will be strictly policed. Worship services. Until April 13th, 2021, services will be permitted for places of worship during the hours 5 a.m. to 8 p.m. A maximum of 12 persons, including officiating clergy and IT personnel, may be physically present to facilitate electronic broadcast from the place of worship. To ensure this is done in an orderly manner, applications are to be submitted to the divisional commanders of each parish through the police station closest to the place of worship, with the list of no more than 12 persons who will be involved in the service. The address of the place of worship and the times of the service should also be submitted with the application. The application form will be set out in the new orders. And I just want to go over this. During the no movement days, that is during the curfew periods, they coincide with times of worship. And indeed, the Easter season is one of the holiest worship seasons on our religious calendar. It is not the intention of the government to deprive people of some avenue of worship. And this is not something that we take lightly, and we understand and respect the right to worship. But in dialogue with church leaders, and I'm not here saying that I have spoken to every church leader. That's clearly not the case and would not be possible. But as much as we can in terms of speaking to some of the leadership, which we expect that what we have discussed would cascade as far as possible to the general clergy of the church. We agree that worshiping in the sanctuary, in the church, would not be advisable at this time, given the extensiveness of the spread and how dangerous the disease is. And indeed, the population that would come to the sanctuary and the church for worship would be the population that would be most affected in terms of a adverse event from any contraction of the disease. So what we have agreed is that we would allow the churches who have the capacity and who can broadcast from their place of worship, that they would have 12 persons in their church that will do the recording, if that is what they're going to do, or if they're going to do live. So it would be persons who are delivering the sermon or conducting the worship in addition to the technical staff that would be needed. And that number would be 12. But they would be required to go to their nearest police station, so whoever is the leader of the church, and give those 12 names to the police and the times of the service, and have those persons being approved, and they would then be able to travel to the church for the purpose, nothing else. So they would have a letter that they would be able to show. So they would have to be traveling within the times allotted. Otherwise, they would have breached the curfew. Weddings. As of April 6, the cap on the number of persons permitted at a marriage ceremony will be reduced from 25 to 15. This will be in place until April 13th, 2021. And by and large, we have seen that persons have made attempts at controlling the size of weddings. But what we are noticing and what we have seen as reports is that in general, especially since we have reduced the numbers, persons have not been maintaining the 25. And these events can be major spreaders. The reduction of the numbers will be strictly supervised. And what we are saying to persons who are getting married is that if you have to conduct the ceremony, do it within the limit that is given, as the essential numbers as possible. The law requires, I'm told, five persons to be there. Certainly the bride and the groom, the officiating pastor, and 2 witnesses. I am not saying to you that that is what you should do. You might want to have the parents there, which is why we have put the number to what it is. But no more than that. And this is up until the 13th of April, 2021. Beaches that are under organized management and control and rivers will remain closed until April 13th, 2021. Zoos, parks, gyms, attractions. Let's go back to beaches and rivers. Beaches and rivers that are not under organized management and control will remain closed until April 13th, 2021. Zoos, parks, gyms, attractions, and bars are subject to the existing restrictions and must close 2 hours before curfew during the period ending April 13th, 2021. So I'm sending a signal that this remains under review, and the continuation of these restrictions is dependent on factors including the level of compliance, as well as case numbers and the numbers in hospital. So, you know, the community bars we have allowed community bars to reopen, gyms, parks, and zoos. How people conduct themselves in these areas are very important, because these are areas of social gathering. For the bars, we are noticing that there is a fall off in compliance, and that is concerning. I think the protocols that we have put in were well designed, and if they are followed, we would see significant reduction. We don't want to close the bars, the community bars. We understand that it is, for many, the lifeblood of their household. It is the main source of income. But just to be clear, that if other measures are required, then this is an area that will be on the list of new measures to come. So, Minister Mackenzie, ensure that you are doing your surveillance so that we can have a report within the next 2 weeks as to whether or not there is any improvement in compliance in these areas. Amusement or gaming arcades not licensed under the Betting, Gaming and Lotteries Act must be closed for the period March 23 to April 13th, 2021. And the Minister of Local Government, I might ask you to give a further explanation about this category of business. Indoor cinemas and establishments that stage theatrical or artistic performances will remain closed from March 23rd, 2021 to April 3rd, 2021. The ban on events such as concerts, parties, tailgate parties, round robins, this will continue until April 13th, 2021. AGMs and extraordinary general meetings of companies and general or special meetings of cooperative societies, friendly societies, or industrial or provident societies are not to be held from March 23rd, 2021 to April 13th, 2021, unless the court has authorized a fully virtual meeting. In extenuating circumstances, an application may be made to the Medical Officer of Health to allow a physical gathering to hold those meetings. But it must be under, for that to be approved, it would have to be extremely extenuating circumstances. Most importantly, the requirement to always wear a mask to cover your nose and mouth in a public place continues, as well as the requirement to be physically distanced from other persons, especially those not in your household, and to either wash your hands for at least 20 seconds or to sanitize frequently. Let me repeat that these measures, the infection control and prevention measures that are in your hands, the wearing of the mask, the maintaining the social distance, and I know it is very difficult for some people to maintain social distance, physical distance, if you want to call it that. I have had the experience where someone wants to come and talk to me. Boss, I want to give you an off-the-ear talk. And you know that means whispering in my ears. And I've had to say, no, no, no. Any talk is on the ear. You over there, so I'm me over here. So. And we can't be afraid to say that in this period of time. We're not being insulting or disrespectful of anyone. But you have to ensure that you guard your social space carefully in this time. Not doing that, you could end up in the hospital. So you're guarding your social space, but if you think about it, you're also guarding the other person because you may not know you have it. You may be asymptomatic. And someone comes into your social space and unfortunately, they contract the virus. So these are things that you can do, and we are urging you to do it. I had mentioned at the last press conference that the Cabinet Subcommittee has been working with the, well, before I go to that point, here I should say that on Thursday, we tabled, the Minister of Local Government tabled the amendments to the Disaster Risk Management Act. And there is agreement that the act will be taken on Tuesday, and it will be debated in the lower house on Tuesday. And we will then seek to have it passed as quickly as possible to ensure that the police is empowered with the new amendments in the enforcement, which would include ticketing for non-wearing of masks and other breaches of the protocols. Now, I had mentioned at the last press conference that a Cabinet Subcommittee has been working with the private sector of Jamaica to develop a model through which the quick service industry can be allowed to continue for longer hours within the curfew. I'm pleased to report that the development of the model, which will be called the E-commerce National Delivery System, ENDS, is far advanced. Businesses and delivery operators registered on the ENDS system will be able to operate after curfew until midnight. We have already commenced limited testing of this service and plan to launch it. We plan to launch it as a pilot in Portmore by March 26, 2021. I want to emphasize that the system will be fully inclusive and will enable the smallest business operator, the vendor, the jerk chicken man, your favorite fish vendor, to participate. I would now want you to look at a short video that will further explain how the ENDS system will work.
Government of Jamaica and the private sector have partnered to develop an e-commerce national delivery solution called ENDS. This is to enable business continuity during COVID-19 curfew hours. Any compliant business or vendor or taxi or bikeman or courier will be able to, once approved to operate during curfew hours, get the ENDS platform once qualified. ENDS will allow any business or vendor to connect to and leverage the island-wide network of delivery solutions to have their goods delivered safely and securely. Registering through ENDS is easy, inclusive, and equitable for all Jamaicans. Vendors without websites are able to sign up for free through e-commerce platforms like WeShops and those provided by banks, and is designed especially to ensure that the small man is included and not left out from making online sales during tightened curfew hours. Once the consumer successfully places an order via a card or top-up voucher, a message confirming the order is sent to the vendor and selected delivery company. For example, a pan chicken man in Portmore. Once the pan chicken man confirms the order, he selects the processing button, which changes the order status, triggering an email that is sent to the customer that states that his or her order is now being processed. When an order is placed, the driver will receive a notification that an order has been made. The notification will include directions to the vendor or established business and also directions to the customer. The driver collects the order, showing the pan chicken man proof via his confirmation notification. On arrival, the driver displays his order confirmation to the vendor as proof of payment. Once the driver departs, the vendor then hits delivered on the app, triggering a third update to the consumer, updating them that their order is on the way. In the event that the driver is stopped by the police as part of the driver's registration, that authorized driver would have received a QR code identifier, which will be recognized as his curfew passport. The police will be equipped with a QR code scanning app that will allow them to authenticate the driver's identity and curfew passport validity. The ends will ensure that even after curfew, consumers will be able to order essential goods such as food and medicine, while also ensuring that vendors and critical businesses can remain in service. Ends, e-commerce national delivery solution.
So you would see then that the government is not trying to destroy your livelihood by putting in these restrictions. We're trying to be as creative and facilitating as possible to the continuation of our economy, but we are doing it in ways leveraging technology that we really should have been doing a long time ago. We should have had a very strong delivery economy a long time ago. COVID has forced us to integrate technology into our daily operations. And this is just one way in which using and leveraging technology will enable business to continue even during the pandemic. Of course, the issue of identifying persons, that is always a challenge, but we are steps closer now to having our national identification system, which will augment the use of digital online services, which will ensure that our business can continue, even if we have to put in restrictions on physical movement. Now, I want to turn to the vaccination program. Now, on Friday, I hosted an online vaccine town hall with Professor Figueroa, Professor Eldemeyer Shearer, and Dr. Melody Ennis. And I think it is important to reinforce some of the very important messages that came out of the town hall. Jamaica has had a long, highly successful history with public vaccination programs. In the 1970s and 80s, many of the childhood diseases that are now prevented by vaccination were very common. For example, we would get outbreaks of measles in which thousands of children would get ill, including myself, and many would have died. We do not see this any longer because of our childhood vaccination program, which is actually written in our laws. In fact, Jamaica and the Caribbean led the world in eliminating common childhood diseases that were preventable by vaccine. The other important point to note is that the science around vaccines and the regulatory scrutiny have both improved greatly. The vaccine that we are using has been tested extensively and approved by several countries around the world. I know one of the common questions that causes skepticism among persons is how was the COVID-19 vaccine developed so quickly? The truth is that efforts to develop a vaccine against the coronavirus started after the SARS outbreak in 2003. The SARS-CoV-2 virus that causes COVID-19 is within that family. It's genetically similar to the SARS virus in 2003. So the two viruses have an 86.85% genetic similarity reflected in their similar names. So they're part of the coronavirus family. So they had started working on the SARS virus. And so the same technology could easily be translated to deal with this issue of the SARS-CoV-2 or the virus that causes the COVID-19. Now, the final point I want to reinforce is that over half of our deaths from COVID-19 are among persons 70 years and older. The risk of hospitalization and deaths increase significantly the older you are. This is a point I made earlier. This is why we have made a priority of ensuring that our elderly, those 75 and over, 60 and over, Minister Tufton tells me that 60 is the new 40. So I can't use elderly with that age group. But you know what I mean. In addition to our frontline workers, they are the priority in our vaccination program presently. I really want to encourage everyone, particularly those most vulnerable, to take the vaccine as soon as it becomes available to you. Minister Tufton, do you want to give us an update on vaccinations?
Thank you. Thank you, Prime Minister. As at Saturday, March 20, 2021, some 24,502 persons in Jamaica have received the first dose of the COVID-19 vaccine manufactured by AstraZeneca. The number represents some 52% of our target for the month, which is 47,650. That's a target for the first month. For the year, we have a target, of course, of just under 2 million, 1.9 million. And to date, therefore, given the 24,500, we are at approximately 1% of target. For the upcoming vaccination week beginning Monday, March 22nd at 10 a.m., and we're going to be sending out information. So if you don't grasp all now, then listen out over the next, well, certainly over the next 24 hours, more information will be made available. But this is very important. Starting at 10 tomorrow, Monday, we will begin to make appointments for persons who are 75 years and older. Beginning at 10, appointments can be made by visiting the Ministry of Health's website at www.moh.gov.jm. That's www.moh.gov.jm. Or you can call the 888 One Love number or 888-663-5683. You would have seen earlier, at the top of the past week, where we signed an agreement, or agreements actually, both for the development of the software and also for a call center to manage the calls that will come in. So we do not anticipate any difficulties. So we invite persons who are 75 years and older to utilize those contact methods. An important note to our 75 years and over, our seniors, is that you may ask a friend, relative, or healthcare provider to assist you with booking an appointment. For those persons who have already submitted their names at their healthcare provider or senior citizens associations, and you are over the age of 75 years, you do not need to apply again. Now, we know that some of the private practitioners and others have been collecting the database of over 75s. We're not asking you to call that number or to register online. Once we get those lists, once they are submitted to us, we will make provisions for your appointment. So we will upload the information and we will make contact with you. Additionally, we will be vetting our list of elderlies who are registered with the National Health Fund and identifying those persons who are 75 years and older with multiple comorbidities. So we're also using the National Health Fund database. These persons will be contacted by phone, and if you have not yet made an appointment, you'll be invited to do so once there are available appointment slots. Once you make contact. Members of the public who are 75 years and older must have an appointment before visiting a vaccination site. So please, it is advisable not to turn up, rather to use one of the contact methods and turn up when you're given an appointment at the time that you're given. Once you come to the site, you'll be asked to present a government-issued ID or a letter from a justice of the peace testifying to your age. So you can use your electoral card, driver's license, or if you have difficulties, you can get the JP in the community to just pen a note attesting to your age, and you can take that. Additionally, in keeping with the vaccination implementation plan, the Ministry of Health and Wellness will continue inoculating other members of the priority groups as previously announced, so our healthcare workers, our JCF, JDF, and government officials over 60. So while we will begin the 75 years and older based on appointments, we will still reserve space to deal with those priority groups that started before, and I listed those. We understand, of course, that many persons are anxious and are asking for more patience. We are asking for more patience as we sort the system out. There have been a number of issues in the last week, the first week of the exercise, and we expected some of these issues to arise. I want to use the opportunity to thank the healthcare team because we have had some 60-odd sites deployed at different times, different days, and we have inoculated over 24,000 persons, which I think is commendable over that period of time. The Ministry of Health and Wellness, through our procuring agent, Prime Minister, just to speak briefly on vaccine access. Through the National Health Fund and collaborating with the Ministry of Foreign Affairs and Foreign Trade, have been working assiduously to ensure the supply of safe vaccines for the Jamaican people. To date, we have secured additional doses of vaccines from the COVAX facility, and within the next 2 weeks, there will be a shipment made to Jamaica of approximately 26,000 additional doses. There are other supply opportunities that are being pursued by the government with the clear policy instructions that all vaccines supplied to the country must be approved by the stated stringent approval authority, that being the WHO, the European Authority, and the Food and Drug Administration, or FDA, out of the US. While we await approval of vaccines, the strategic posture of the government has been to make every effort to ensure that we engage with all manufacturers through the bilateral or direct contact to ensure that as soon as vaccines are approved, the shipments can be guaranteed. As said earlier, Jamaica has had a long and very valuable relationship with the critical authorities to assist us in this approval process. While it is true we have excellent clinicians, researchers in medical science, we do depend on these global bodies to help us to ensure that whatever we administer on our population benefits from the absolute support, research, and sign-off of bodies such as the World Health Organization. And I think, Prime Minister, I can stop here.
Thank you for that update, Minister. 1%, certain people listening would be saying, oh, that's very low. Given the constraints and the circumstances, it's 2%. In 2 weeks, right? We've gone 1% of the population in 2 weeks. Given everything, I think we have done fairly well. But we have had a discussion internally that we need to ramp this up rapidly. And we know you have the Blitz program planned, and that we will roll out very shortly, and which is why we have allowed movement during the curfew hours for vaccinations, because we don't want to slow that down. It's very important that is done. I'm going to invite to just give a brief update as to where we are in the education system, particularly since exit exams are looming, to just give an update. Minister Williams, join us, and then Minister Mackenzie.
Thank you, Prime Minister, colleague ministers, members of the team of the Ministry of Education, Youth and Information who are online, our Permanent Secretary, Dr. Grace McLean, our CEO, Dr. Kassan Troop, members of the media, good afternoon all. So given the new directive that you would have heard from the Prime Minister, that all our students who are currently engaged in the face-to-face modality should return home and revert to the online or virtual space and the other modalities that we have available. I want to remind all of you, especially those of you who are in the exam mode, that we made changes with regards to the PEP. These were told to you a week or so ago, and that we are only requiring you to do the ability test. We would have also informed our CAPE and CSEC students of the additional month that you have to sit the exam and the flexibility regarding the deferral and the publication of the broad subject areas for paper 2 ahead of the exam. We would have put out some information as well with regards to City and Guilds. We ask you at this time that you continue your preparation at home. Additionally, I have to advise that we will pause our mobile intervention in which we were going into communities to find students who were not in touch with their schools and having them in small groups of 5 for 1.5 hours twice per week. As soon as we're able to again, we will advise you. Daycares will continue to be guided by the Disaster Risk Management Act, and the PM would have spoken to independent schools already. Given that we have to rely more heavily now on online learning, we want to remind our students of the digital resources that are available. The ministry's e-resource app, which is hosted through Book Fusion, has a full array of all the ministry's digital resources and is available online as well as offline. EduFocus, that platform that many of the students are familiar with, will continue to offer online support for our PEP students. One-on-One, another company with which the ministry has a relationship, also will continue to offer online support for secondary level students who will be sitting CSEC and CAPE. Additionally, there should be no child without textbooks. We have distributed physical as well as e-textbooks. We want to remind parents and students that the ministry will continue to absorb the cost for students and teachers who use the Google Suite Learning Management System. Unfortunately, if your school is using something else, then that cost will be yours. We recognize as well the need that still exists for devices despite the enormous efforts thus far. In reviewing the Own Your Own Device program, the OYOD, that we launched to help many needy families, we note that 19,908 applications would have been received from parents earning $500,000 or less annually, and we have started to send out the $20,000 e-vouchers, and many persons have been purchasing their devices. To date, 6,003 persons would have received e-vouchers. Of that number, 3,647 would have redeemed their vouchers already for tablets and laptops. With regards to PATH lunches, given that all students will be at home, we will be working with the Ministry of Labor and Social Security and the Ministry of Finance and the Public Service to begin again to send the funds to parents at home so that they could provide for students. Given that all of our students have to be back at home, many in the virtual world, We've taken a decision when we looked at the Own Your Own Device program to raise the income threshold to $1.5 million. So now persons earning up to $1.5 million can apply for the device to receive the $20,000 voucher up to our limit of 36,000 families. We will publish the details of this in the coming week. We understand the disruption that this will cause for all our students to be back home again using primarily the online world. I know we have other modalities that are available, or we still continue to broadcast our lessons on TV, on cable network, on radio. We still continue to have our learning kits. Many of our students were adjusting quite well. We know the anxiety for the exam students, but we want to assure everyone that we will continue to provide all the support that we can as we once again transition into the virtual space. From where we are now, returning our students fully to face-to-face mode again is in the hands of every Jamaican. Every time we do not wear our mask or wash our hands or keep our distance or attend that unauthorized drink up or house party, we're delaying the reopening of our schools. And so I want to say to every Jamaican, our children's future is in all of our hands. Thank you.
I don't know, invite the Minister of Local Government, Honorable Desmond McKenzie, to just give a brief update on the situations with funerals and sports.
Thank you, Prime Minister. In regards to the announcement you just made as it relates to funerals, there are other measures which was agreed on in the discussions with the trade. As you said, Prime Minister, burials will only be allowed between Mondays to Fridays between the hours of 9 a.m. to 4 p.m. Additionally, in that regards, all funerals, all burials that are to take place, the police and the municipal corporations must be advised 2 days in advance of each burial. Now, this is important because the members in the industry felt that it would bring some semblance of order to what they are trying to achieve. And we are insisting that persons who are making those arrangements, that the municipal corporations and the police be advised 2 days prior to the interment taking place. We will continue to work with the industry to ensure that we do as best as possible to continue to facilitate the burials of loved ones. But let me make the point that the 2-week exercise will give us an opportunity to see how well it works, and that will make the necessary decisions that will go forward after the period. So I will be meeting with the industry again on Tuesday morning to continue these discussions. As it relates to the operations of gaming lounge and arcades, and these facilities that a lot of young people attend on a daily basis, we are closing these locations, and these gaming lounge where the machines are used by number of persons. We are concerned about the increasing number of cases that are associated with these locations. So effective immediately, these locations, as mentioned by the Prime Minister, will be closed. We'll be monitoring the beaches and rivers to ensure the compliance are in place. And we are working closely with the Ministry of Health to ensure that all the protocols that have been set out is observed during this period. Prime Minister mentioned the concerns we have about the tavern bars and the community bars, the village bars. Again, these are areas that we are monitoring, and we will continue to monitor these areas. The Office of Disaster Preparedness and Management is in receipt of a letter from the Premier League Association. And after consideration of the proposal, permission will be granted to the Jamaica Premier League to commence training in an organized environment once the Ministry of Health has agreed on the protocols. We will be working with the Jamaica Football Federation and the Premier League Association to ensure that the training is facilitated. And once we are confident that there's an improvement, then we will look at other measures as it relates to football. But for the time being, training will be facilitated to allow the national squad and the players to be in a position so that they'll be able to qualify for the necessary encounters that is out there on the national scale. Just to say that the government will support the measures to ensure that our national teams are able to participate in international events. We know that the World Cup is coming up, and we know that the Gold Cup is also coming up. So we will do everything to facilitate the sports. But let me just make the point that this is not a license for open competition. Permission is being granted for training, and it is organized training that will be monitored on a daily basis by the Office of Disaster Preparedness and the local authorities. So in essence, ladies and gentlemen, the government is giving consideration as much as possible, and we are asking for assistance at a very critical time when we make these decisions in the interests of the country. Thank you.
Thank you, Minister Mackenzie. I think you would have mentioned that the training is to take place under conditions that we refer to as a bubble. So it is not as if they are training at large. It is in a very controlled set of circumstances, limited to a specific number of players and properly administered. In conclusion, we face what could be described as an existential threat. The potential breakdown of our health system is more than something that we're speculating about. It is a serious threat, and it is of grave concern. And we have to take the measures that we have put in place today in order to bring these numbers down rapidly. Before, when we had announced these measures, we have always been very careful with the police and other law enforcement agencies to police in such a way that we recognize the rights of the individual and that our actions could never be perceived as heavy-handed. These measures will be accompanied by a different type of policing. The measures are announced several days in advance. So the police and the military will have enough time to draft plans for an increased presence on the roads and in communities, mobile presence and static presence, to ensure that on the no movement days and during curfew hours, that there is no movement that is not approved. So I'm giving enough notice that you will be prosecuted. You will be charged. The police are vaccinated. So too are the soldiers. So the other concerns that may have existed about infections and so forth, those are very minimal now. So we are expecting that there will be a higher level of prosecution. We have to take this very seriously. So I'm just putting that in the atmosphere for those who want to let that sink in, as Minister Tufton would say. So another matter of the ENDS program, we think that this is an innovative way of keeping businesses going. It will not be a free-for-all, and it will be gradually implemented. As I said, we are testing it in Portmore, a community that is relatively structured and organized with many businesses and households in close proximity to businesses. So delivery would be easy. So it's a good area to test to see that it can work. We are expecting that all the persons who enroll will follow the rules. Businesses will not be open to the public. So the businesses that are going to produce the food for which the delivery will take place, they are not to be open to the public. Special provision will be made for their staff that would have to be working to produce whatever goods it is that has to be delivered. But they cannot open to the public. The delivery can only take place if the driver is certified on the system and is able to show their digital passport, as it were, for which the police can verify. We know that there are persons who would seek to parade as if they are approved and seek to disguise themselves as approved delivery personnel for nefarious means. This will be strictly prosecuted as well. So we are at a difficult juncture, no doubt, but I'm confident that we will be able to bring the numbers down and protect our health service, protect you, keep you safe, and ensure that we have a stronger, faster, better, more equitable, more sustainable recovery. I thank you.
Thank you so much, Prime Minister, for your update to the nation. And certainly there are many questions, really clarifications from members of the public and members of the media. As usual, before we come on live, we do test with our media representatives or virtual platform. And we ask now that if you have questions, please raise your hand. I'll acknowledge that you have raised your hand and you will be able to ask your question. As we await that, there are several persons who are from the public, sir, who are just seeking some clarification. I have one here as we await members of the media. In as much, sir, as accommodation is being made for people going to the airport in keeping with their travel itinerary, can persons who have already made hotel bookings for the Easter weekend getaway make their way to or from the hotel over the Easter weekend, for example, travel to a hotel on Good Friday and travel on Monday to return back home?
So let's clarify. We have movement hours and no movement hours. If you travel within the movement hours, you're fine. But no movement hours, you can't present your ID and say, I'm an emergency worker, but I'm on my way to a hotel. That won't work. No. So you are only able to move on an exemption pass if it is in relation to your duty. And I want to just make that explicitly clear, because I know there are persons who would want to abuse that. You're only able to move on an exemption pass if it has to do with your duty or with what the pass has specified. So, for example, someone who has to manage a business, and that business is critical to, continuation of government and support and so forth, they might get a pass, but it is only in relation to that, not for anything else. So the simple answer is get to where you're going before the curfew hours.
Thank you, sir. Let's then go to Ms. Dion Jackson-Miller from the RJR Gleaner Communications Group, who has a question for you. Mrs. Jackson-Miller.
Thank you so much, Naomi. Thank you so much, Naomi. My first question is really a follow-up of a question I'd asked last week. Just the Prime Minister had said he would check on the situation, involving fit testing for medical interns who were complaining that they hadn't been tested, asking if you had managed to do that, sir. All right, my questions for this week. The Ministry of Health has said that the major problems in terms of the spread of COVID are the public transportation sector and the workplaces. Yet these measures announced this evening do not specifically target those sectors of society. And given that the PM has to stand in front of a press briefing and ask employers not to make employees who have COVID symptoms come to work, and that we're seeing the taxis and the buses ram and the coasters ram, clearly these are not sectors that have been amenable to the persuasion, that the moral suasion that the Prime Minister has been trying to use. So can you tell us then, why isn't the government doing more to target these two very significant problem areas? All right, that's one. Then why aren't we significantly ramping up testing from its current situation? Three, in relation to the vaccine promotion, I know what the Ministry of Health says should happen in terms of the leftover vaccine at the end of the day. We all know that that's not what has been happening, and all kinds of people who are not in tier 1 have been getting vaccinated. That's a fact. And the problem is that the ministry hadn't started the central registration until, well, still not started. And even the elderly registration doesn't start until tomorrow, 10 o'clock. What can you tell us to ensure that we don't have the kind of problems we've been seeing and the very distressing scenes that we saw this week of elderly persons clustered at vaccination sites trying to get vaccinated? And finally, how can you tell us if anybody, and if so, how many people have died because of the oxygen shortages in the hospital? So I'll just I'll just go back through that quickly. One, the fit testing for medical interns. Two, the public transport and workplace. Three, why aren't we ramping up testing? Four, how do we know that we're not going to continue to have the problems with the vaccine rollout this week? And 5, if there are any numbers as to people who have died as a result of oxygen shortage.
All right, I saw Minister Tufton taking notes, so he will answer the questions directly related to the Ministry of Health. But the question you asked about the strategy of the government in responding to workplace clusters and transportation is a very good question, because the strategy may not be immediately visible. In other words, if we were to, for example, take a measure such as we're going to limit the number of persons on buses. Let's say we said that for every other seat in a bus should be empty and absolutely no standing. Without taking the other measure, which is to say, don't go to work, work from home, then reducing the number of seats would only exacerbate the problem, make the problem worse, because then it would mean a longer time to move the commuting public to work. So the measure that actually works is to reduce the commuting public. That works, and which is why we have put in place the work from home measure. We can enforce this on, for example, government entities. Now, once we go into a work from home measure, there are certain requirements that government would have to meet. For example, we may have to give people laptops. We may have to give people dongles so that they can get internet access. In other words, making the requirement comes with some obligations on the part of the government. In our discussions with the private sector, and by the way, the workplace clusters applies both to government entities and to private sector entities. So the government is taking the actions that it can manage the obligations for, which is the public entities, and we are enforcing those. And we are working in partnership with the private sector. Now, many private sector firms, I don't have all the specific numbers, but the reports that we have gotten is that private sector firms have taken this up, and they are having their staff that can work from home. And the truth is, they are finding it, most of them, very convenient to do so. That in most instances, productivity has not gone down. In some instances, productivity has actually gone up, and working from home is likely to be the new normal for many professions and many areas of work. So it is working, Dion, and I think the general lockdowns that we have will also have an impact on people moving to work, because you do have quite a number of firms that are open on weekends, open on holidays still. Putting a restriction on movement during the weekends, during the holidays, will also have an impact on the workplace numbers. There are other measures, Dion, which we haven't outlined here, but are in the Disaster Risk Management Act, regarding how particular operations are governed. You will recall that we had placed special measures for BPOs. There are also special measures for certain kinds of operations. Those we are trying to refine and fine-tune, because that would require a new mobilization from the Ministry of Local Government to go and inspect along with the Ministry of Health. So we are going to have more institutional-based rules, but we are trying to put in place the measures to supervise. You will recall that for the BPO sector, we literally certified each operation for its reopening and then went and scrutinized their operations thereafter. We don't have the capacity to do that now, where the capacity for the Ministry of Health is stretched at the hospitals and the other areas of service delivery, but more so stretched and focused on giving vaccination. So that is why it is these set of measures that we have put in place. But you're correct, there are other measures which we could have used, but we just don't have the capacity to implement them now. I'm going to ask Minister Tufton to take the rest of the questions.
Thank you, Prime Minister. In relation to the fit testing, the regions were contacted as a follow-up and emphasis around fit testing, instructions given to them. My understanding is that the Western region have started the process. Southeast region are to get kits this week, CMO, and I would need to check with the others, but all have been contacted to ensure that the follow-up where it was absent takes place. So I'd have to check with the other two regions because persons here, the PS and the CMO doesn't have any information outside of the instructions that were given. As it relates to the vaccine rollout, you know, your narrative and I fully appreciate the right to project a narrative around the failure of the process over the past week plus. My own judgment on the matter is that the team in the field, the health team, the infrastructure that was put in place, and the administration in the first instance of the process went very well. And I will not resile from that. We administered to date over 24,000 vaccines. I think how many vials? PS, about 1,500, close to 1,600 or so vials, meaning each vial containing 10 doses, 10 to 11 doses. And we had up to 60 odd locations across the country. I visited at least 6 parishes where doctors and nurses worked hard to put those locations in place, and they administered the vaccines for the most part incident-free. There were at least 2 centers where we had issues or major issues, and in one case, the National Chest Hospital, that facility was shut down and recalibrated, and then things went back to normal. There's another St. Joseph's where private doctors were asked to go to get vaccinated, private doctors and nurses or persons in the private sector. There was a crowd there, and that crowd came out of persons coming for their vaccine shots and taking their significant other. So a male was asked to come, a doctor, the wife came, or the help staff, or the other relatives, and that created a scene at that location, which the PS was deployed to go to on this Saturday, I believe, and he had to sort that out. The other locations, like the Good Samaritan facility at Heroes Circle, where we did have persons congregating on the outside, was because persons turned up. They did not have an appointment. They were aware that we were administering vaccine shots at that location, and in their enthusiasm and anxiety and maybe even fear, they just turned up at the location. And we have had that at a number of locations across the country. To my mind, those cases are not an indication of a failure of the process. It is a case of a desire to be vaccinated, which we appreciate and applaud and encourage. And in the first instance, persons just trying to get the job, even though they were not slated at the time, they were not part of the priority group. And that created a situation at those locations. Now, we want to urge Jamaicans, and in this most recent phase of the program, 75 years and older, please use the appointment system and don't go to the location unless you have an appointment and a time for that appointment. We can't control persons turning up. We can discourage it, but we can refuse to provide the service because others are in line to get the service and there's a limited quantity, but we can't control it. We can't control it if persons are insistent on turning up. Having said that, I think it will get better with time. We have worked on the kinks that we have identified, and I think the system will move in a better way going forward. Now, you ask finally, Prime Minister, about the appointment system and that we are not ready. We are ready. In the first instance, we did not need an appointment system to deal with the healthcare workers. We know where they are. They're in the hospitals, in the health centers. We did not need an appointment system to deal with the JDF and the constabulary. We know where they are. They're very targeted groups. And so that went according to plan. The appointment system is now coming online for the first time when we need it, which is tomorrow at 10 a.m., where we are now appealing to a more generalized population located right across the country in different parts of the country. And as they call in or upload online, or the list come from the private doctors or from the NHF or from the clinics, they are going to be scheduled and given a time. And so we are not behind. There's a lot of energy and enthusiasm, but we are playing according to the plan. And we'll continue to work out the errors. We're not perfect, but we'll continue to work out the kinks as we go along. But we ask the public for patience. Thank you.
Thank you so much, Minister. Prime Minister, I know there are several shy members of the sporting fraternity, and they've sent in some questions, many of them similar, so I'll just ask the one that resonates. Do the restrictions impact track meets scheduled for the period?
Minister will answer.
Prime Minister, in regards to the question, we have been working very effectively with the GA3s in regards to their development needs, and we are satisfied with the response from the GA3s in the meets that they stage on a weekly basis under strict protocols. So those meets will continue once the request is made and the protocols are observed, as we noticed that they have been doing over the last 3 weeks.
Thank you, Minister. Prime Minister, another member of the media with a question, Ms. Stevie Ann Simmons from Nationwide Radio, and several persons from the diaspora have been sending in some questions. We'll go to some of them as well. Stevie Ann?
All right, so I have two questions. I'm not sure if I missed it, but I wanted to find out from Prime Minister Holness when he'll be taking the vaccine. And also, can someone give us an update on the work from home in the public sector? Because, for example, one employee, well, at least one employee who is a clerk at the Jamaica Post, she said she made a request to be added to the work from home list, but the access was denied. And for example, she is not able to go into work because she has a child at home and she had to miss some days during last week. And she's wondering if those days will be taken from her vacation days. So just a general update on that, the work from home policy in the public sector.
I mean, so far, what I've been told, I have not had a full report yet, but I'm certain I'll get one tomorrow at Cabinet, is that it has been working fairly effectively. It will not be even in terms of how discretion is used, because it is really up to the entity manager, the permanent secretary, the executive director, the director general, the directors, to determine what staff is critical to the continuity of the government's business and what staff could be working from home. So I could well understand why you may have these kinds of cases. If you would like for the specific case to be looked at, you could send me the information or send it to Naomi, and I will look at that. We reinforce, however, to the permanent secretaries and to the entity managers that their posture should be to have as many staff working at home as possible. And just remind me of your other question, Stevie Ann. Oh, when I'm so I'm slated to take the vaccine tomorrow. So it's not quite in line, but because everybody's saying you should take it, you should take it, you should take it. Minister Tufton took his on Friday. The grouping in which I would fall would be the frontline government workers, and when I say frontline government workers now, these are the persons who are necessary for the physical opening and continuation of a government's business. So the cashiers, the receptionists, the persons who deal with cases, they have to interface with the public, the various inspectors and so forth. So those are considered critical. We estimate that there are about 5,000 of those. And then with that group as well would be a group called government officials. And those would be persons under 60 who are in the executive positions in government, and including in that would be councillors and MPs. So we would have started that next week, not necessarily next week, Monday, but I will take mine tomorrow. Now, important point. I mean, a lot of questions were raised about why I didn't take the vaccine and so forth. It's a balancing act, because the important message must be sent with only 64,000 doses of vaccines that you must wait your turn. If someone calls me to say, my mother, my father, my sick relative, I have to be in the moral position to say no, which I've had to be in that position, saying no to many persons. If I'm not in that position, in other words, I did not wait my turn, my position would be weakened. And a lot depends on the leadership that I give, because if ministers feel that I have taken it and they deserve it too and they didn't get it, and then it goes down to permanent secretaries and it goes down to directors, the whole system collapses. The questions that you're asking me now would be it will be far more difficult for Minister Tufton to answer, that people have turned up who are not in the appointment queue and getting vaccines. So far, out of the 24,000 that would have gotten, how many were not in the queue? 94 persons. That's the statistic I saw yesterday. It might be a little bit more than that based upon the new statistics. But no more than 100 got vaccines that were not programmed or in the queue. And that is because we took the position, knowing the history of the distribution of scarce goods in Jamaica, that there has to be order in it. And I hope the Jamaican people understand that this is about ensuring that the people who really need it get it.
Thank you so much, Prime Minister. It's 19 minutes past 7 o'clock. We'll do another 11 minutes of question and answer. I do have some from the diaspora, sir. And there are two in particular. One, are remittance agencies considered essential services? And secondly, for Jamaicans who have traveled overseas and gotten vaccination, how do they now come to get validation in Jamaica in terms of the documentation that they have the vaccine?
I'll ask the CMO to address that. But yes, we do consider banks and remittance services to be essential. However, just to be clear, they can only open during the business hours permitted outside of curfews. So they can't open during curfew hours, just to be clear on that. CMO?
Yes, they just have to present their cards. I'm not sure where it is that you are asking specifically that the vaccination was required. But I mean, the certification that they receive in their country would be accepted here. So they just have to present it.
SMO, if I could have you just stay right there. There's a member of the elderly population who's asking two quick questions. One, in terms of what arrangements have been made for those 75 years and older who are confined to their homes for vaccination. And there was a follow-up to that one. I'll just find that back. But yes, go ahead.
Right. So there are persons that are not able to leave their homes. We had asked through the MAG for those persons to submit, the doctors to submit the names of persons to the health departments, because we would have to make special arrangements for those persons. But we really want to see what is the distribution of those persons to see the types of arrangements that we would have to make. But we do intend to get to those persons. Special arrangements would have to be made. Please submit your names to your private practitioner, or if it is a public health practitioner, so that the arrangements can be made.
Thank you, SMO. The other question, I'm cognizant of the time, and we do have two others on the Zoom platform from members of the media, Mr. Damien Mitchell and Ms. Vanessa Silvera. But there was a question, a clarification, again, from persons in the diaspora concerning why they would have to, even though they have been vaccinated, why they would have to then come back to Jamaica and quarantine. If you could reiterate those points in terms of the rationale.
Okay. So right now, we don't have a large number of our population that is vaccinated. So your coming to Jamaica certainly means, if you have gone the required time, it certainly means that you are protected against getting COVID-19 if you have been exposed. However, there is still the risk that you may be able to transmit the virus if it is that you have been exposed to somebody who has the virus recently. And so because our population has not been protected, you still represent a risk to us. Also, there is a time period that you will develop immunity, and it is not everyone. We know that it is not everyone that is going to develop the immunity. So there is still a risk that exposure can lead to infection. And so therefore, the 14-day incubation period is still necessary to see if you will develop infection. So that is why it is still in place.
Thank you so much, CMO. Prime Minister, we now have Ms. Vanessa Silvera from JIS who will pose her question to you. Vanessa?
Good evening, Prime Minister, if you will. Could you please provide further explanation about the approval process for business operators whose products and services will be offered on the ENDS platform? For example, what kind of verification process will be used to determine if you use Panchikin Michelle or Panchikin Roy, who operate from the same location?
So there is a registration process that would have to be undertaken. Minister Mackenzie, you want to come and explain? So it's well worked out, I can say, while Minister Mackenzie makes his way. There's a registration process which includes identification and clearance with the police. So Minister Mackenzie, you explain.
Thank you, Prime Minister. The program, the persons involved will be registered through the municipal corporations. They will obtain the necessary license permit to operate. And they will be issued with the necessary ID cards, etc. So they will operate under the strict control of the local authorities, working closely with the Office of Disaster Preparedness and Management. So they will be actually be called itinerant traders. So that falls under the old umbrella of the local authorities.
There will be a kind of public education program to ensure that all persons who want to participate have the information to effectively do so.
Thank you so much, Prime Minister. Quick question from social media again concerning the closure of schools. Does it also pertain to nurseries?
Minister Mackenzie.
The closure of schools would not affect the operations of daycare facilities and nurseries. Remember, these facilities are operating under strict protocols, and they have been observing the protocols. And I just want to point out that some of the measures that we have put in order for them to operate are very difficult, and they have been maintaining the protocols. So those establishments will still be allowed to operate during the period. The closure does not affect nursery and daycare facilities.
Thank you so much. Again, Prime Minister, the very shy sports journalists continue. They need clarification on the training sessions for the football teams. Oftentimes, it's being said, training includes the organization of friendly matches to see what progress a team is making. Will these training friendly matches be allowed as part of the training regime for football? And I think they want some better clarity on the track meets during the period.
Well, in terms of the football, the discussions will continue with the management of the National Premier League and the Jamaica Football Federation as to the protocols that are going to be observed as it relates to the training. I don't know, Naomi, what clarification is required on the track meet. What I'm saying is that the meets that we have granted approval for are trials, and these are specific trials that the J3A have requested of us. We have not yet received any other application for consideration for any other meet outside of the trials that are the time trials that are organized by the J3As, and these trials are to allow the athletes to be qualified to running qualifying times to participate in international events such as the Olympics.
Thank you so much, Minister.
I think, Minister, you have to emphasize that what we're trying to do is to support organized sports. This is not a general reopening for sports. So we work closely with the sporting organizations, the sporting governing body, and in working with them, we develop the various protocols, which is in keeping with the principle on how we make decisions regarding the measures, our principle of being situationally appropriate. So we look at each sport, each event, and then we make protocols around them. We try to facilitate as much as possible. And clearly, any event that is going to cause the numbers to increase or put lives at risk, we will not consider.
Thank you so much, Prime Minister. Final question then from a member of the media, Mr. Damien Mitchell from the Gleaner. Damien?
Thank you very much, Naomi. Prime Minister, I have 5 questions. We should be through them
All
in
of
3
5.
minutes or so. Do you reckon that it was ill-considered for the government to make it mandatory for people over 60 not receiving up to $1.5 million annual pension to be vaccinated in order to receive the proposed new COVID grant? That's question 1.
There's good economics behind conditional cash transfers. We do conditional cash transfers all the time. In fact, the whole PATH program is based on conditional cash transfers. So it is a solid means of ensuring that if government is going to give a grant, that in exchange for that grant, we get a particular kind of behavior that supports the public good. So if you're saying that vaccination is not in the public good, then that is inconsistent with the arguments that you have been carrying that I should take the vaccine and everybody else should take the vaccine. What we're trying to do is to promote everyone to take the vaccine, and we give incentives to do it.
Can you say, Prime Minister, what actions you've taken since you've learned that your instructions were disobeyed and people have been skipping the line to get the COVID vaccine?
Well, I can tell you that the permanent secretary and the minister can tell you what I have done. And what they have done as a result of that. I think they well understand. And, I'm glad you asked that question, Damian, because, the cascading of directives does not always, it's not always the case that the directives that you give from the top are followed immediately or as directed. And so there is a process of reinforcement, and we have gone through that process of reinforcement. Mind you, Damian, there are persons who have their own personal views on how the vaccination program should be administered. There are persons who definitely feel that, whoever turns up, those are the persons you should give first. There are persons who believe that only persons over 60 should get. So in the administration of it, you can find that there is some policy drift. However, we are not tolerating it. So though it has happened, and identified it down to about 90 cases, between 90 and 100 cases. I am certain that as we go forward, the policy direction is clear that you must wait your turn, which is why I myself have tried to lead by example and wait until my turn. I mean, I can tell you, I have not, made any provisions for my family members or anyone, because at the end of the day, I must be able to enforce the rules as the person ultimately responsible.
But you will not say what actions have been taken.
No, actions have been taken. The permanent secretary and the minister both have been given specific directions as to how the program should be done. The permanent secretary, I know, based upon what I have said to him, and the minister both have prepared a circular, that's a proper term, which has been sent to all persons administering the vaccine regarding how the priority list should be adhered to. And I haven't seen that there is any breach since that administrative directive has been given.
Can you say what is the update in respect of the missing vaccines in St. James?
I know there is an investigation ongoing. I'll allow Minister Tufton, if he would wish to give a report.
And Damien, in the meantime, since we're at 7:33, if you could ask the others other questions you have, so that we'll be able to just get all the resource persons to your questions.
There was a consideration of staggering the work hours, and the final is whether, this is coming from an athlete, wants to know whether there are any risk of adverse findings for athletes who may take the COVID vaccine. So those are the other two questions I had.
Yeah, the staggering of work hours, so we have not thrown everything that we can into the orders. As we say, we are progressive. We would increase the restrictiveness in a progressive way. Right now, the measures that we have, we believe are a good balance relative to the problem to keep the economy going whilst keeping the numbers down. But staggering the work hours, yes, that is something that was considered, and probably if it gets any worse, then that is something that we might have to do. In terms of adverse findings for persons taking the vaccines for sports, I'd ask the CMO if she would address that question. Thank you for your questions, Damien.
In terms of the adverse effects for persons involved in sports, no, we would not. I have not seen any effects that have been coming out in the media where this is concerned. As a matter of fact, young persons are usually healthy, and therefore it is advised that when it is their time that they should take the vaccine.
Thank you so much. And then Minister will respond to the final question.
Thank you. In relation to the missing vial, the management of the institution was asked to investigate. The police, I believe, has been brought in to investigate, and there have been some personnel adjustments just to ensure that it doesn't reoccur. But let me just say for the record that to date, we have used some 2,200 vials have been used. There is always going to be an expectation of some waste. There is a global standard of some 3%. We have set our target at 2%. And to date, our waste or equivalent has been 0.03%. So far less than 1%. So I think under the circumstances, I think the team in the field is doing very well. But of course, the objective is not to waste any. I think in one instance, a vial fell off a table and broke. And in another instance, someone had the vial in the hand, and I don't know what happened. And there are a few doses left in that particular vial, and it broke. So you're going to have some of these things happening, and this is a global phenomenon. But as the Prime Minister said, it is our intention to minimize this as best as possible. Thank you.
Thank you so much, Minister. Thank you, Prime Minister, for a comprehensive media briefing. If you could, members of the public are asking just again the main pointers for what you have announced, and two, they're also asking if this also applies to the keys. Final question. Thank you so
Applies
much,
to
sir. The keys, Pedro Keys,
Yes,
Ryan
all the
Keys.
measures apply to Jamaica. All measures apply to Jamaica. And the Pedro Keys, yes, they are still closed. All right, just to recap for the curfew hours. So on Tuesday, March 23rd to Friday, March 26th, the reason why we're starting Tuesday, the new order, the present orders expire tomorrow. So the new curfew hours will begin on Tuesday. So from Tuesday the 23rd of March to Friday the 26th of March, the nightly curfew will remain at 8 p.m. to 5 a.m. The following morning at 5 a.m. Now, on Saturday, March 27, 2021, the new curfew hours will begin at noon on the Saturday. Now, just bear in mind that on the Friday, we're asking for work hours to be from 5 a.m. to noon to give workers and commuters enough time to do shopping. So your shopping hours would be between noon to 8 p.m. on Friday. Now, on Saturday, March 27, 2021, the curfew will begin at noon and continue through the following Sunday, the entire day, and end on Monday at 5 a.m. Just to be clear, markets would close, remind me, Minister Mackenzie, 1 hour before the curfew hour. So on Saturday, markets would close by 11. Now, you and I know, Minister Mackenzie, that we go market early, like most people. So you have to get your shopping in early in the markets. Now, on Monday, March 29th to Wednesday, March 31st, the curfew will commence at 8 p.m. nightly to 5 a.m. the following morning to 5 a.m. on Thursday, April 1. Now, on Thursday, April 1, which is Holy Thursday, again, we ask workplaces to allow their staff to leave at noon for them to do the necessary shopping and commuting up until 8 p.m. on that day. The curfew, therefore, begins at 8 p.m., continues through Friday, the entire day, until, which that is Good Friday, until the following Saturday at 5 a.m. At midday on that Saturday, the new curfew begins. So the shopping hour on the Saturday after Good Friday would be from 5 a.m. to noon. Remember now, markets close 1 hour before. So on Saturday at noon, the new curfew begins, and it goes right throughout Easter Sunday. And it goes right throughout Easter Monday. No movements on that day. And it ends on Tuesday at 5 a.m. The same would be the case for the following week, which would be on Tuesday, April 6th. The curfew will commence at 8 p.m. and nightly to 5 a.m. the following morning, ending at 5 a.m. on Saturday, April 10. Now, on Saturday, April 10, the curfew will begin at 12 noon and continue through the rest of Saturday and the entire day on Sunday, ending 5 a.m. on Monday. Of course, just for clarity, the Friday before, that is Friday, April 9th, we would ask businesses to allow staff to leave at midday so that they can do their shopping and commuting. And that will be the lockdown hours essentially for 3 weekends starting next weekend coming. And those measures, we believe, will significantly reduce the infection rate, will reduce our, what they call the R0, the reproductive rate, and bring our hospitalizations down and relieve the stress on our health system. Ladies and gentlemen, thank you for listening.
Thank you so much, Prime Minister. Thank you so much to members of the media, members of the public who have joined us. We apologize to those who may have some further questions, but if you pose them online, we'll be very happy to assist and to clarify any point that you may have raised. Thank you so much to everyone who's joined us this evening. Please do stay safe and have a very, very good Sunday evening.
Government of Jamaica and the private sector have incurred